The Eastern Cape province has experienced dozens of fatal crashes this festive season, with the number of deaths on the roads surpassing 80. Road accidents have also put pressure on the province's health system, with over 4,000 trauma cases since the start of the festive season. We're now joined by Dr. Rolene Warner, Eastern Cape Health Department Head of Department. A very good evening, Dr. Warner. Thank you very much for your time. Now, at the weekend, you already had over 19,000 medical admissions and close to 5,000 trauma cases. What's the situation now, more or less?
Good evening and Merry Christmas to you and to the listeners. As one can expect across the weekend, especially with the inclement weather, we have had more injuries related to trauma and associated with motor vehicle accidents on our roads.
Assuming that you had put in place contingency measures ahead of this period, knowing, of course, the situation in that province when it comes to accidents and the like, is your system under constraint? Are you coping? How would you describe the situation?
Thanks for you. So in anticipation of this period, we know that we always get an increase in motor vehicle accidents and injuries related to other forms of trauma and violence. At the same time, we get not only gunshot wounds, we get drownings, we get fires, and so we have to prepare the entire system to accommodate that. We also have an increase, as you read from your statistics, in medical cases because patients sometimes don't take their chronic medication and that leads to complications. So as you said, our entire health system has been prepared for this period. What we've done is we've taken our 90 hospitals, we've configured our services around what we call hubs and spoke arrangements so that we can optimally deploy our staff to hospitals that we've identified to be those sites that will be taking on the load of the trauma cases that we're anticipating to come through and that will have the surgical capabilities to deliver babies and intervene in surgical cases.
But
with respect to our emergency,
Yes, no, you can continue though.
With respect to our emergency, because that is our first response, we've actually increased the number of vehicles ahead of the season. So we brought on 36 additional vehicles. We now have a capacity of around 220 ambulances on our roads, and we have strategically placed them along the routes where we know we have high volumes coming in during the festive season and where we know these are hotspots where accidents can typically occur. In addition, we have deployed our aeromedical helicopters. Again, we've placed them strategically. And during the periods of Boxing Day, Christmas Day, New Year's Eve, and New Year's Day, where we know the number of drownings can go up, we've also let them patrol the beaches so that we are able to respond as soon as possible to where accidents do occur. And so we've configured the system. At the same time, we've had to decant our facilities. So where we have patients who are stable and well to go home, we make sure that we discharge them as soon as it is appropriate to do so. We've also decreased our outpatient visits, like many other facilities in the country. We've given our chronic patients 2 to 3 months medication so that they can take the medication at home and allow the staff that we do have available to be focused on responding to what we know is going to be a spike in cases related to MVAs, gunshot wounds, trauma, and the like.
Of course, notwithstanding the efforts or what you have put in place, we're talking here about a province that doesn't, like any other, I suppose, have abundant resources. Add to that allegations of waste, fraud, and corruption. That's why your SIUs have had to be brought in.
So in one phrase, you've thrown in a lot of complex issues. I mean, the SIU relates to 17 incidents related to a single supplier that is being investigated. And we've always welcomed investigations. Our figures that are proxy indicators of fraud and corruption in the system has systematically come down. Our in-year regular expenditure, I've cited before, has been less than 6.8 million for the last 2 years, which is a significant reduction from where it was 3 to 4 years ago. So yes, we acknowledge that there are challenges, and yes, we are highly constrained with the available resources. At the same time, we've not been folding our arms. We have a turnaround strategy that we have been implementing, and that we're starting to see measurable improvements in those indicators. For now, during this season, it's to make sure that our available resources are best deployed where they are required. At the same time, Vuyo, we do want to appeal to our listeners. If we can decrease the number of avoidable accidents on our roads, it obviously decreases the burden that we have to face in a system that is already strained in trying to cope with the day-to-day occurrences that present to our facilities. So it is important that our Arrive Alive campaign that was hosted by our MEC, as well as the MEC for Transport, that motorists adhere to some of those advices and guidances. So vehicles need to be roadworthy. Drivers must rest. They need to make sure that they observe the rules. Especially in the Eastern Cape, we've had really inclement weather, and that has contributed to the risk of accidents on our roads. So we need to be patient out there with each other and observe the rules of roads to minimize cases of MVAs. Similarly, with medical conditions, if we have chronic diseases, it's important that we take the medication to prevent complications from setting in. And so health is everybody's burden and everybody's responsibility. Each person has a role to play in making sure that we reduce and avoid unnecessary presentations of ill health and disease to our system.
Well, a call, one hopes that people on the ground especially will heed with respect to those accidents, but also avoidable illnesses and sicknesses. But when you returned to the position of HOD a few months ago, it was so that you could precisely deal with some of the issues that you've touched on. You're saying you are seeing improvements. Tell us a bit about those improvements, but more importantly, how they have come about by way of your own initiatives.
Well, no person ever does anything on their own, Vuyo. We act as a team, and we're fortunate to have political will and support for the initiatives that we are trying to drive in our department. And so we have the Office of the Premier, Provincial Treasury, working together with us as a Department of Health to ensure that we stabilize the department. One of our biggest challenges has been the financial situation of our department. We have huge accruals and payables. We now have a proposal to manage that debt across a particular period, and we will be engaging with our suppliers to stabilize the debt. We've also managed to stabilize the loss of money from our system due to medico-legal settlements. There's an entire integrated medico-legal settlement that is in place. Similarly, we're addressing issues, as you were mentioning, fraud and corruption. That links to having in place controls. And so in the last 2 to 3 years, we have significantly decreased the in-year irregular expenditure, as well as fruitless and wasteful expenditure, to be almost negligible at the moment. Again, we're not saying that the system is perfect. If the SIU were to investigate and they were to find that a supplier has somehow managed to evade those controls, it's an opportunity for us to improve and prevent this from happening. But we are quite pleased that, as I say, we have significantly reduced both fruitless and wasteful expenditure within the health system. That's just to name a few. We're obviously focusing on improving the quality of care. And so there are a whole series of initiatives that are involved in making sure we deal with the burden of disease, our communicable diseases like HIV and AIDS and TB, as well as dealing with maternal, women and child health. We're pleased, I heard your previous article was talking about teenage pregnancies. Yes, teenage pregnancies is a problem in the Eastern Cape and in certain parts of our province. However, the initiatives in the last 2 years working with our social partners is now starting to see some benefits. Year on year, we've had a decrease of around 1,200 fewer teenage pregnancies in each of the last 2 years. So we are starting to make some progress as we're heading in the right direction.
I mean, when you, at about the same time you took over, we were talking about 6 billion in unpaid bills, but your operational budget had almost been wiped out. Are you saying the situation has since improved?
The debt is not eliminated. So the debt is there. We've analyzed the debt. And from that debt, we've 6 of our creditors we owe around 3 billion rand to. So it's to negotiate with those 6 creditors that we can pay them the current debt that is owed to them, but at the same time, make sure that we have a debt repayment plan. We've also applied with Provincial Treasury to SCOPA for condonement of the unauthorized expenditure. It's around 2.4 million that we've put in an application for. Our prayer is that that would be dealt with, condoned with a finance bill to restore some funding into our baseline. But at the same time, we've also got to make sure that we eliminate waste and inefficiency. And so we've identified a number of projects, about 11 to 12 different projects, looking at our cost drivers, and we've initiated projects to try and control the expenditure in those line items.
Now, there was a lot of controversy when you were brought back, people taking issue with you being placed in the Premier's office. Has that assisted in the things or the victories you've managed to secure?
We all HODs serve at the behest of the Honourable Premier. When the Premier deployed me to Office of the Premier, it was to do specific projects. I was involved in those projects, working with the Department of Transport, the Department of Education, and I'm hoping that we made some positive contributions in those areas. When it was felt that I needed to return to the department, the mandate remains the same. It's to turn around the situation at the department, stabilise the debt, but more importantly, improve the health outcomes of the people in the Eastern Cape. And nobody can do that on their own. We have to do it in partnership, but we are also focusing on the social determinants of health, working with our strategic partners, with other government departments, so that we can promote health and well-being, prevent disease, and decrease the burden on the health system.
Of course, I mean, you were, from what we were told, at the time, you were also getting assistance from the National Department where a team was deployed. Is that team still there, or has it done its work and you are now able to do everything on your own?
So a task team has been set up. The National Department is represented on the task team along with the Provincial Treasury and Office of the Premier. Ultimately, the members that make up the task teams come from our Department of Health. And so we have 5 work streams that have been set up to deal with the critical areas that I've reflected on already during the course of this interview. And we are implementing that as a department, supported where necessary from the Department of Health National, as well as the Office of the Premier and Provincial Treasury.
Of course, there's always the warm story of Christmas babies. More than 44 bundles of joy before lunchtime today. Were your systems able to cope? And as much as this is a good and positive story that we like, especially on Christmas Day, does it come at a cost?
So when I last checked the stats, because we have a dashboard, we have 118 babies born on Christmas Day. 12 of those were between the ages of 10 and 19. So most of them were over 19. As I was saying to you, we've identified from amongst our hospitals, there were 21 that provide cesarean section and backup in the event there are complications that need to be dealt with. So this is what we expect in the system. Generally, October tends to be the month where we have a huge uptick in the number of deliveries. Similarly, 9 to 10 months after the Easter vacation, we then have an uptick in deliveries. But it's something that we prepared for and that we welcome the babies today. We work with Home Affairs also to make sure that these babies are registered. And really, it's a time of excitement to welcome them onto this earth in our facilities.
It is indeed a beautiful thing, I mean, to welcome a child to this world. But you mentioned earlier, you touched on the teenage pregnancy issue. What are some of the complications or that come with even this joy?
Yeah. So essentially, it's logical that a young child, age of 10 to 14 years, besides the psychological trauma of being pregnant at that age, is the physiological trauma. So that the young child's body is not necessarily suited to have and deliver a child per vaginum. And so it's an incredibly traumatic experience for young people to be going through a pregnancy. Often they're confused and not even aware that they're pregnant at the beginning. And that is why in the Eastern Cape, we work really closely with our strategic partners, with traditional leaders, with community structures, because the focus, as we work with the Department of Education, the Department of Social Development, the whole focus is to empower young people, empowering young girls so that they have control over their reproductive health, but also empowering boys to be confident, to know what is right, what is necessarily wrong. And so it requires a whole of society approach. This is not something that we're going to be able to solve on our own as the Department of Health. It will require a whole of society approach. But as I said, we are really pleased to be having a lot of community-based organizations come forward, offering assistance and working with communities. Hence us seeing the decrease in the number of teenage pregnancies year on year for the last 2 years.
You mentioned earlier, made a call, in fact, to people to really avoid those avoidable, to avoid, again, to getting themselves into unnecessary accidents, to drive safely on the road and so on. What about the role of alcohol in both accidents, but also sicknesses, people stabbing one another under the influence? The Enyobeni tragedy is still fresh on our minds.
Yeah, it's absolutely horrific. It's absolutely horrific. So substance abuse, in particular alcohol abuse, we should never drink and drive, never. Secondly, when it's, as with most things in life, it's to do everything in moderation. And so if we are going to have alcohol, observe the limits. There always comes a time, when I was working as a medical officer in casualty, there's a certain time in the night beyond which it now is no longer fun. The level of alcohol becomes so high that you end up having friends coming in, having assaulted each other. So Livingston statistics, the team shared it through with me earlier today, and 25 of the cases seen today on Christmas were assault cases. There were 7 MVAs, and so you can see just proportionately, as much as MVAs are a challenge to us, the number of cases that are coming through assaults is just alarming. And so you're right, alcohol needs to be dealt with responsibly if we are going to be drinking alcohol, and that we must know our limits. In that way, I think we can often avoid a number of complications. Alcohol, as you know, decreases your inhibitions. And so it's not only assaults that we see, but it's also, and stabbings and chest wounds and gunshot wounds, but it's also that we see that young people no longer are inhibited, in particular young people. And so you have unprotected intercourse, which leads to pregnancies. It can also lead to the transmission of communicable diseases.
And of course,
yes, I agree.
And of course, contribution to the gender-based violence pandemic. Let me thank you very much, Dr. Warner, for your time. Really appreciate it.